Today we will be assessing the effectiveness of therapeutic footwear to prevent ulceration in those with diabetes. As podiatrists in a primary care practice, we wish to investigate the effectiveness of therapeutic footwear in preventing foot ulceration in those with diabetes. As the practice manager wishes to only stock and provide footwear that is clinically proven to be beneficial for outcomes within patients, we are undertaking evidence-based practice research. By undertaking research, we will determine whether therapeutic footwear is clinically proven to get excellent outcomes for patients with diabetes in the reduction of foot ulcers. According to Diabetic Foot Australia, 1.2 million Australians have been formally diagnosed with diabetes, while there is an estimated 1.7 million with the condition nationally in total. The most common foot concern in individuals with diabetes is foot ulceration. An ulcer is a patch of broken down skin. It is extremely common in people with diabetes due to reduced blood flow and damage of nerves. This can inhibit healing and mask pain in lower limbs, which can mean that mild injuries can lead to ulcers. Reduction in blood flow caused by the narrowing of arteries impairs the immune system's ability to heal injuries. Damaged nerve function is known as neuropathy, which can result in pain, tingling, weakness, or reduced sensation in the feet. Loss of sensitivity can alter walking patterns and therefore can cause increased pressure in certain areas of the foot. This loss of sensation can mean a mild injury can progress unintentionally to a more serious foot injury and even result in amputation. Smoking, being overweight, and high cholesterol are all risk factors for foot ulceration, as well as the wearing of poor footwear. Due to poor footwear being a risk factor for the formation of foot ulcers in individuals with diabetes, we will undertake research into whether therapeutic footwear is an effective intervention in preventing foot ulceration in individuals with diabetes. Therapeutic footwear may act to reduce peaks in pressure on the foot. We will investigate whether this intervention should be applied within our practice. We wish to present the best research evidence available, and we will critically appraising a high-quality trial which investigates the effectiveness of therapeutic footwear in the prevention of foot ulcers in those with diabetes. In order to search for trials, there are relevant scenarios. With relevant scenarios, we've created a research question using the PICO mnemonic that we will use to begin our database searches. Our question is therapeutic footwear effective in the prevention of foot ulceration in those with diabetes? So within the mnemonic, P stands for the population. In this case, it will be those with diabetes. I for intervention, which will be the therapeutic footwear we will give to the experimental group. C is for the control group to compare with. They will be using their own shoes. And finally, O, which stands for outcome of interest, which in this instance is the prevention of foot ulceration. In our search strategy, we utilize the CINAHL database for our article search. Upon using manufactured or custom, shoes or footwear, ulcer or ulceration, we received thousands of results. We then limited our search parameters to include the English language, full text, humans, articles published within the last 25 years, peer-reviewed articles, alongside the subject major heading of diabetic foot. This narrowed our results down to 19 results. The article we decided to use was number 5 on the list, Diabetic Shoes, Manufactured Shoes in the Prevention of Diabetic Foot Ulcers. Appraisal of the article utilised the Pedro scale. For the first criteria, the eligibility criteria was specified, in that for to be eligible, participants required previous history of foot ulceration, which they were then randomly allocated to groups of normal shoes or therapeutic insoles, which satisfied the criteria number 2. Although criteria number 3 allocations were not concealed from the conductors of the experiment, meaning that there could have been biases arise. For criteria 4, the groups were similar at baseline regarding their important indicators. So the characteristic of the participants identified in Table 1 were very similar in relation to gender, age, duration of diabetes, and type of diabetes. Although they did also fail to blind the subjects as to which treatment they were receiving, which could have led to other biases. The study, however, failed to blind the therapists who were administering the therapy and the assessors who were measuring the key outcomes that were being identified throughout the study. Although 85% of the subjects initially allocated to the groups were measured on one key outcome throughout the study, as the article provided results on the two different groups on their 1 year follow-up appointment comparing the control versus the experimental group. Criterion 9 was achieved as the patients were alternatively assigned to wearing either their own shoes or the therapeutic shoes assigned by the assessors. And the between group statistical comparisons were reported for at least one key outcome, as the ABI and VPT were compared between the control and the experimental therapeutic shoe group. Likewise, the study did provide both point measures and measures variability for at least one of the key outcomes throughout the study, as the results were expressed as a means plus or minus the standard deviation within the results. A prospective multi-centre randomised follow-up study of participants with previous foot ulceration was conducted. The number of ulcer relapses was recorded during the 1 year follow-up of the control group, which consisted of 36 participants who wore their own shoes, and the therapeutic shoe group, which consisted of 33 participants who wore custom therapeutic footwear. Relapses in the control group over the 1 year period were 58.3% compared to 27.7% in the treatment group. This gives us a p-value of 0.009 with a confidence interval 95% between 0.2 to 1.5. As the p-value is below 0.05, we can see that the null hypothesis is therefore rejected, meaning that there is a real difference between the groups and that this difference is unlikely to have occurred based on chance. The p-value shows that there is a statistically important difference between the treatment and the control group. The mean ulcer-free time was longer within the experimental group compared to that of the control group at 9.1 months, plus or minus 3.7 months for the experimental group, versus 3.7 months, plus or minus 3.1 months in the control group. This had a p-value of 0.02. Biases were identified throughout the study that may have had potential implications for the results. Ascertainment bias. Initially, as the study does not mention any blinding of investigators, they may have been subject to ascertainment bias, as their knowledge of which participants get which treatment may impact the results within the clinical trials. The second of which, assessor bias, could have potentially been subject to assessor bias, as blinding the investigators was not completed for this study. Therefore, it may have impacted their ability to be impartial in regards to the measurement of results, as they may have had prior knowledge on who was wearing each individual shoe type. The third of which, allocation bias. The study did manage to avoid allocation bias, as the groups were randomly selected. All 69 individuals had the same chance of being selected to either the ordinary non-therapeutic shoes or the therapeutic shoes with custom moulded insoles. And lastly, selection bias. As the study avoided selection bias, each individual had to meet a certain criteria regarding their history with foot ulcerations to be included within the study, to directly assess and represent the population of those who had foot ulcerations and ways to prevent it. In terms of application of this evidence into practice, the therapeutic shoes were proven to be effective in the prevention of recurrence of foot ulceration among those with high-risk diabetes. There was significant variation in the relapse percentages, with 27.7% in the experimental group and 58.3% of those in the control group experiencing a reoccurrence of foot ulceration following the 1 year period. This provides an effective method of prevention that requires little change on the patient's behalf, as there is no significant variation to the way that they are able to carry out their day-to-day life, merely the change of a pair of shoes. The prevention of foot ulcerations can also result in various positive implications for the health of these patients, as it may result in increased physical activity, blood flow, and an increase to overall health. Meanwhile, the Australian government also provides subsidisation of diabetes-related products to those that are registered under the National Diabetes Services Scheme. The government subsidisation of this results in the increased ability of those of lower socioeconomic backgrounds and those who may not have the money to afford these shoes, the ability to purchase them to increase their overall health. There are various limitations of the application of therapeutic footwear, as the cost of these footwear is extremely high for many families across Australia. Not all the population have money to spend on footwear such as these. The highest cost makes it difficult for lower socioeconomic status population to purchase them without assistance from the government and subsidisation of these products to be made more available. And also the fact that shoes are very limited to the settings that you can use them in, whereas one pair of shoes may not be used in other settings, so that it can be counteracted by the fact that improper shoes can reverse the positive implications of the therapeutic footwear. Overall, the recommendation is that the custom therapeutic footwear is recommended for use among high-risk diabetic patients to prevent the relapses in foot ulceration over a period of time. We recommend adherence to the wearing of therapeutic footwear as much as possible as to prevent adverse effects of use of other shoes. Also, registration within the National Diabetes Services Scheme in order to receive subsidisation of diabetes-related products to make these therapeutic footwear more affordable for more populations.